Welcome and good afternoon. Thank you for joining us today. Before we begin, I would like to note that the views expressed in written conference materials or public publications and by the speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Next slide, please. Hi, my name is Cindy Rivera, and have the privilege of serving as a change consultant at Change Matrix for SAMHSA's 988 Crisis Response Training and Technical Assistance Center that is operated by Altarum. I'm going to transition over to Olivia to take a moment so that we can familiarize the audience with the technical aspects of the webinar. She'll walk you through the webinar interface, including how to submit questions and other technical information. Olivia.
Thank you, Cindy. As you see, closed captioning is enabled for today's webinar. We also have American Sign Language capabilities, and you'll see the interpreters are spotlighted throughout the presentations. If you need tech support during today's webinar, please reach out using the Q&A function and we will address it for you. Lastly, if you have any questions for the presenters during their presentation, please also enter those into the Q&A area and we will address them as time allows at the end of all three presentations. Thank you.
Thank you. Olivia, let me now give you a brief summary of what we will cover today. We're going to hear from our SAMHSA leadership, and then we have 4 distinguished speakers in the equity space who will share their insights around equity in crisis response systems. We will have time for questions with the speakers and close out the event with the office hours so that everyone can stay on and ask questions of SAMHSA or the Crisis Response Training and Technical Assistance Center. Next slide. Okay, and just for those of you who may or may not know, the Crisis Response Training and Technical Assistance Center was selected by the Substance Abuse and Mental Health Services Administration to provide training and technical assistance support to states, territories, tribal organizations, and community partners across the 988 Suicide and Crisis Lifeline and Crisis Continuum of Care. Along with Altarum's partners, W2 Consulting and Change Matrix LLC, who have extensive experience with crisis services, technical assistance, and health equity. The Crisis Systems Response Training and Technical Assistance Center was formed to support the continued growth of 988 Lifeline and build a more robust crisis care system. And next slide. Okay. For what we will cover today, after this presentation, attendees will be able to understand how to engage effectively in community in the crisis response system, identify ways to build upon successful community engagement strategies, learn ways to define community through an equity lens, develop strategies for involving the appropriate partners, and explore how to build authentic relationships in your community. Okay, next slide. I now have the pleasure of welcoming our SAMHSA leadership. Jill Mays, who is the Division Director for the Crisis System Transformation and for the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA, is one of the leaders in this effort. And today we have with us Dr. Laura House, who is the External Engagement and Equity Lead with SAMHSA's 988 and Behavioral Health Crisis Coordinating Office. You can take it from here, Laura.
Thanks so much, Cindy, for that introduction, and welcome. Good afternoon. It's so good to see you all here, and I'm happy to be here to support this important topic. This webinar series is the product of planning done by SAMHSA's 988 and Behavioral Health Crisis Coordinating Office. Before we move forward, I want to thank our SAMHSA leadership, headed by SAMHSA's Assistant Secretary, Dr. Miriam Delphin Rittman, and the senior executive team. I also want to thank Monica Johnson, who is the director of the 988 and Behavioral Health Crisis Coordinating Office. Our office is working tirelessly to provide support, guidance, and technical assistance to states, jurisdictions, and territories to ensure that people across the U.S. have access to the crisis care that they need and at their most vulnerable times. This webinar series is one of the many opportunities to engage with the 988 team and Crisis Response Training and Technical Assistance Center on equity-based topics. More information on how to access those opportunities will be provided later in our session today. But for now, I want to get started because we have a great panel lined up for you today. I'm joined by a panel of subject matter experts within the field who are experts in community engagement. And I now want to take some time to introduce them. As our first speaker, we have Dr. Rochelle Espiritu. She's a Filipina immigrant and a research psychologist who centers equity in training, technical assistance, and capacity building that she provides in the areas of behavioral health, evaluation, workforce development, systems change, and policy development. She's a founding partner of Change Matrix, a minority and woman-owned small business that motivates, manages, and measures change to support communities and systems that improve lives. Previously, Dr. Espiritu was a faculty member at Georgetown University and served as the director of evaluation for the Georgetown University Center for Child and Human Development. She's passionate about service, leadership, and community engagement. And she also serves on numerous state and local boards and is a former school board member of Denver Public Schools and received her doctorate in clinical psychology from the University of Colorado at Boulder. After Dr. Espiritu, we will have two speakers who will be presenting together, Don Ramos and Joshua DeBartolo. Joshua DeBartolo serves as the Senior Manager of Community Integration for the Oklahoma Department of Mental Health and Substance Abuse Services. He's worked in several roles in the behavioral health field since 2016. In these roles, he attended since 2016. He attended the University of Oklahoma, where he received both his bachelor's and master's degrees in human relations. He's also a tribal citizen of the Comanche Nation, and in his personal time, he's actively engaged in the local Native American community. We also have Don Ramos, and he is the Program Development Director for the Wichita and Affiliated Tribes 988 Tribal Response Grant. He's been working in the field of substance use disorder prevention and suicide for over 24 years, with a particular focus on the Native population. For the past 7 years, he's been actively involved in suicide awareness and prevention as an applied science intervention skills training facilitator. He's provided training opportunities in Native communities, and he's a tribal citizen of the Comanche Nation as well, and a member of the recovery community with 26 years of recovery. In his personal time, he enjoys being a grandfather to 19 grandchildren, wow, and 4 great-grandchildren. You're busy. We have a great group of leaders joining us. In addition, we have Charles Rice, Charles Anthony Rice. And Charles is the Community Engagement Specialist for the New York State Office of Mental Health and a co-chair for the New York State 988 Community Education and Awareness Project. He's a husband, father of 5, and dog dad who has always had a heart for helping to bring support and resources to underprivileged and underserved communities. He focuses his time, attention, and skills on working within communities that have been labeled and or considered to be at risk. Through his own lived experiences as a youth and young adult, he's overcome significant hardship and is now on a journey of holistic recovery and positive impact relationships. He knows firsthand that positive impact relationships and understanding can have mean so much, and he desires to be a bridge to give opportunities and a brighter future for all the people of New York State and beyond. So with that, I want to turn things over to our first speaker, Rochelle, Dr. Espiritu.
Thank you so much. I'm so honored to be here with you today. Thank you, Dr. House. It's such a pleasure to share some thoughts and strategies about how to keep communities really at the center of our hearts and minds in this work. So during my brief overview, I'm going to start with the importance of defining some of the key concepts that we'll be talking about today, taking an important look really at how we define community through an equity lens. Then I'll offer a few core principles about community engagement, leaning on a framework from the National Academy of Medicine. And finally, I'll share some equity practices that we can consider in community engagement, but really know that my co-presenters who are in community will be the ones bringing these strategies to life. So on the next slide, I'd like to offer this idea to help us kind of center ourselves in the importance of community engagement in equitable response systems. So I'm just going to go ahead and read this. Community engagement is the cornerstone of an equitable crisis response. By actively involving all community segments, particularly the most vulnerable, we ensure that our strategies and solutions are not only effective, but also fair and inclusive. This approach transforms crisis systems from merely being reactive to profoundly resilient, making sure that no one is left behind in their most critical moments. So I know we often use the phrase that we'll build the ship or field and people will come, but I'm here today to share that that might necessarily work in this particular case of building the new system for 988. So on our next slide, as we kick off this conversation, it's important to remember how crucial it is to start on the same page, especially when we all come from different places, from different sectors or systems. You've probably all had the experience where you might be in a meeting, nodding, agreeing with a conversation, only to realize later that everyone had a different idea about the topic that was being discussed. And so that's exactly what we want to avoid here. So it's important to make sure that our language is not just clear, but that it also connects with everyone who's engaged in the work. And so we want community to feel connected, to feel like the terms speak to us because they're about us. And so I know there was a first 988 webinar on equity, which I hope you've had the chance to watch because it set a great foundation. Today, we're going to zero in on the community engagement part of equity. So I wanted to make sure that we can unpack the terms community and engagement a little bit separately. So I want you to think a little bit first, because I know we don't have the chat available. So I want you to do a little thinking first. Take a moment to think about your own community. What words or phrases would you use to describe your community or communities? Because I recognize that we identify with multiple communities. And jot those down. Take a moment to jot it down or write it on your electronic device. I think what this does is it helps bring our own perspectives into the conversation, and it enriches our own understanding as we go along, because spoiler alert, we're all community members. I heard that in the bios. You heard it in mine. We are members of a community. So one of the ways I think about my community first is about my physical neighborhood. I'll describe that as supportive and engaged. I also think about the larger education community that I'm a part of, which currently feels a little bit divisive. Another community I'll share is my connection with the Asian American, Native Hawaiian, and Pacific Islander community in Denver, which is very small, less than 4%, but mighty. I describe it as mighty and involved. So let's go on to the next slide and think about, well, how do we define community through an equity lens? What does community really mean? So first thing to note, and I'm sure you all know this, and as you did your reflections, communities aren't monolithic. So if you might imagine a mosaic, each piece will have its own color, its own shape, its own texture. That's our community. It is a combining of different and diverse groups, each with diverse and unique needs and backgrounds. The other thing to note is intersectionality. Our identities are not single layered, as you just heard from mine. There are different factors like race or age or economic status that all overlap to create unique experiences and needs. So if you think about a few examples, you can think about things like maybe the community in Appalachia. Here, addressing kind of the geographic and economic barriers is crucial as you think about your 988 systems. And you might be thinking about engaging different kinds of partners like churches to effectively engage the community. Whereas maybe in a tech and diverse area like the Silicon Valley in California, even though it's quite wealthy, there are some challenges that area faces, like income disparity and resource access, which really highlights the needs for thinking about how you be inclusive in your approach, and in all communities well. It just helps us understand why each community's unique makeup is going to be crucial to thinking about some of the tailored and effective crisis responses that you can explore. And you'll hear that more, I know, from the other presenters as well. So in the next slide, as we now think about what community means to you, what you might think it means to others, let's dive into how we can define community in ways that ensure that no one is left out. So how do we make sure everyone is included? Well, these are some critical questions that you can be thinking about to help guide your thinking. So who is currently benefiting from these new systems that are being created? Who's harmed? Who might be getting overlooked? Who is missing? Who isn't here that should be? Who are we not engaging? So those questions really help us to spot the gaps in our community outreach and areas where we can improve. So I want to spend a little time thinking about, well, how do you address those gaps? So think a little bit about what you know currently about your community. Do you have maps? Do you have demographic data? Have community surveys been done? So personal interviews. This isn't just about the numbers, it's about really understanding the tapestry of needs and experiences and aspirations that make up the communities that you're serving. I'll talk a little bit more later about engaging with community leaders and organizations as another strategy, and we'll also share a great resource with you called the National Network to Eliminate Disparities in Behavioral Health, or the NED, which is a SAMHSA-funded initiative that offers a great resource for you around community-based organizations that are doing important work in behavioral health equity and disparities. So let's go on to why having an equitable definition of community really matters. So if you only have kind of half of a puzzle, my dad loves puzzles and I keep sending them to him. If you only have half of them, you're not going to get the full picture of what makes that entire puzzle piece or puzzle beautiful. And without that full picture of who makes up our community, we're not going to be effectively addressing everyone's need during a crisis. And so by truly understanding and having that understanding of the groups that are in your community, the voices that are in your community, you can really create a tailored crisis response that is spot on. And it means that no one is left out because your solutions are really built with everyone in mind. And the other truth is that when people see that their needs are being met, their identities are considered in the planning and the response efforts, they're more likely to trust the system and cooperate with the efforts that you're embarking on. It's about seeing essentially a reflection of themselves in the action that you're taking and that you plan to take. And here's the really big payoff. Communities that are engaged inclusively tend to be stronger and more resilient. And why is that? Because these inclusive engagement, it taps into the full potential of community, making sure everyone is prepared. So I wanted to just offer, I'm not going to go a lot into this particular framework, but the resource is available to you. It's from the National Academy of Medicine. They did a lot of work around how to capture and think about community engagement as the engine that really drives significant systems change. And so look at how community engagement is kind of at the center and everything kind of radiates out from it. And so it kind of notes the dynamic movement of how to get to goals of health equity and systems transformation. So I think I asked Olivia to post that link in the chat as well. And I encourage you to go in and read the blog about it. So let me move on now, because I'm running out of time quickly, to thinking about some equity practices and community engagement. We'll dive into each of these a little bit more, because I wanted to note that these practices they're all interlinked. They all influence each other. So the first topic area I wanted to offer is how to think about addressing power imbalances. So on the next slide, you can see, think about identifying power as a seesaw where the weight is uneven, and that might symbolize the imbalance in community decision-making processes. And that happens when certain individuals or groups wield more control over processes because of things like socioeconomic status or race or gender. So there's oftentimes, and I'm sure many of us have experienced this, when the people who are most impacted by the problem or the condition rarely have voices or at the seat at the table, right? Or they don't even know the table exists. And so how do we think about ways to challenge these imbalances in our own work? And so how do we ensure that we're giving space to all voices and actually listening and to responding to them? So some of the ways that we can think about doing that, and we can go on to the next slide, is to think about how we might create things like expanding representation, thinking about decision-making structures that include the voices from marginalized groups. And so you might think about your advisory boards or other structures that you have that expand to have diverse representation, and to think about things like having a consensus-based decision-making process so that majority rules isn't what dominates. It's also important to think about access to information to make sure that everyone has access to consistent information about how decisions are made so that people can come in with knowledge and skills to participate in a really meaningful way. And I'd encourage you all to think about facilitation techniques as you're engaging communities. So sometimes we're thrown into the role of facilitation, but I think that there are some really intentional methods that can be used to make sure that every voice is heard. So you might be thinking about round robin speaking, small group discussions, anonymous feedback options. These are all things that we've used on multiple projects and are important to do. Another tool, I'll go on to ensuring, because I know we're running a little bit late, but in that inclusive communication is pivotal to ensuring that the systems are accessible. And so I think these are probably some things that have been discussed in previous webinars, but will really help you think about how to make your 988 system most accessible. And again, it's by knowing who's in your community and understanding what are their language accessibility needs. What are the translation needs that are necessary as you're doing community meetings or broadcasting to help people understand what is available? Also thinking about accessibility, like what we have available on our webinar today, ensuring that there is the feature of sign language interpretation or closed captioning, making sure that physically people have access to spaces if you're engaging them in meetings, et cetera. I'll also just make a quick note around technology because I just got back from the Pacific Islands where I do some TA support as well, and know that for them, WhatsApp, if you're familiar with that app, is the communication method of choice. And so that is how I now communicate with my colleagues in the Pacific Islands. And so knowing those nuances in your community is important. I'll talk more about community networks too a little bit later, and want to again direct you back to the NED, which is has an amazing database of over 1,600 community-based organizations all across the US and in some of the territories that are resources for you to start to develop relationship with. Why don't we move on to the next slide around cultivating long-term engagement and trust? So for many of you, you all know that working in community takes time. It is important to build these long-lasting relationships. We're not going to get this done in one grant period and say, oh, I've developed trust with the community and I'm done. This is long-term work. And so part of what that means is being present, being in community. I loved hearing the bios from other folks in here. As I said earlier, we are all community members. We need to go to events. And so being present at them is important. Hosting those kind of events regularly is important to show that you are there and you're not there just during crisis, but that you have a presence and you're invested in community. I think there's also an importance in being transparent around what the system can currently do, right? This is a new system that is being built. And so some transparency around limitations and what the capabilities are will also help build trust with the community. Maybe you know you're not quite at the point of saying we have translation available for everyone. Or that we haven't really gotten yet to the local churches or to other groups. Being transparent about that helps to foster the trust within the community. And finally, around education and empowerment, I think there's this opportunity as you're building your 988 systems to empower communities to be knowledgeable about what crisis management can look like, how we can engage in resilience building, and what resources are available to community members. And I'll just put in a plug for engaging youth. If we can engage our young people and community members through educational programs and initiatives, that get them to know more about 988. They are our future leaders, and they're going to be our informed citizens about 988. Every time I meet someone these days, or I'm in different groups, I'm asking them, hey, have you heard about 988? And it's letting me know, like, how good of a job are we doing in our own communities in terms of that awareness? So I want to leave you last with this next visual, because I just love this visual. I think I try to use it almost in a lot of my TA, because one, it gives us a way to think about engagement. The icons in here are meaningful. So let me walk you through this. So when you think about this, this outlines stages of public participation that go by the different levels of public involvement and the influence that we can have over decisions, moving from less engaged to being empowered. So if you look on the left side, you'll see this inform section, where really the level of engagement here is to provide people with information. You're pushing out information. You can see the arrows going out to the circles. Then you move on to consultation, which is where there's this opportunity to engage and get feedback from community about after decisions might have already been made, but before they're finalized, right? So this involves listening to the community, what they have to say, and really considering feedback from them in your decision-making processes. And then there's this deeper level of involvement where we're actually now thinking about having workshops, public forums where community members can discuss issues, explore options, really influence the outcome of decisions that are made about the 988 system. And then collaboration involves partnering in a much deeper way, getting advice and innovation from the public so that we can integrate their knowledge and input as much as possible into the final decisions that are made. So now you can kind of see how more complicated those arrows become, both between people, community members, and with the planners, the implementers of the system. And finally, it'd be just great if we can work within the system to get to the most involved level of community engagement, where final decision-making is kind of placed in the hands of the public, where community has the authority to make some final decisions and implement them. So if you take anything away from this, I'd love for you to go back to this visual, to be able to see how you can think about engagement in a way to make equitable decisions about the 988 system. I am done with time. I'm going to ask folks to put my contact information into the chat, and I'll be staying on for Q&A. So thank you again for the opportunity. I'll turn it back to Laura.
Great. Thanks so much, Rochelle, for that great presentation. You really helped set a strong context for our conversation.
Let's see, it looks like we're having some trouble hearing Laura, but let's go ahead and pass the baton over to our next speakers, Josh and Don.
Hey, how are you guys doing this afternoon? Hello from Oklahoma. Let's go ahead and move on to our next slide. Today, wanted to start off with an analogy and illustration of what we're doing here in Oklahoma. So if you're not familiar with the analogy or the symbolism of the three sisters, so it's three different elements and three different plants together. So it's corn, beans, and squash. And until recently, I didn't know that traditionally certain tribes would actually plant these three elements together on little hills. Next slide. So when the three sisters are planted together, it actually works in a great relationship where they're actually helping each other. So the beans actually fertilize the corn and the squash. The corn stalk actually supports the growth of the beans. And the squash provides ground cover between the corn and the beans. So when they're growing, they're all thriving together. And there's a link right there for the USDA talking talking more about how they were planning together and the culture and tradition of that utilized by certain tribal nations. I will admit, this is not a practice of my tribal nation, the Comanche Nation, but this is something that is used by many different tribal communities throughout the United States. Next slide. So when we're talking about 988, and we're talking about crisis continuum of care in Oklahoma, I look at this as bringing federal, state, and tribal partners together into one system. Here in Oklahoma, we have one call center. We have a crisis continuum of care that covers all 77 counties, and that includes coordination and working with our tribal nations in Oklahoma as well. Here in Oklahoma, we have 38 federally recognized tribal nations, 39 overall tribal nations. But when we think of this analogy of 3 separate plants together, we're all planted together in this small mound. Think of Oklahoma. We're all planted here together. We're all in the same area, and we're nurturing each other like family when planted together. And it's just this beautiful analogy of being stronger together. So when we're talking about helping to expand services and making sure our crisis continuum of care is available for all Oklahomans, that's the goal, right? And really, I wanted to mention this. I didn't put a slide in here. But I wanted to mention that this whole ability for 988 to have this great groundwork and relationship building and really had some momentum behind it, it was done through relationships that were built prior to the launch of 988. And those relationships were built by going in the community, engaging and getting to know different tribal nations throughout Oklahoma. I tell people I'm the king of going on coffee and lunch meetings because I've never seen anybody upset while eating fajitas, right? It's a very disarming thing to have folks sitting there eating fajitas or drinking coffee and getting to know each other in a neutral location. So I have a philosophy on building relationships, and I won't be able to get into that today, but I will say that I'm a millennial and I like to play on words. So my philosophy is called backing that ask up. There's a K in there, just making sure you guys heard that right. And we can get into that another day, but go ahead to our next slide. So again, in Oklahoma, in July 2022, Oklahoma was awarded, obviously, the 90-day grant, which is ODMHSAS, or Oklahoma Department of Mental Health and Substance Abuse Services overseas. And then subsequently later on down the road, tribal nations were awarded the tribal 90-day grant as well. So overnight, essentially what happened was we had this 3-number system come to life, and we also had mobile crisis teams that were covering all 77 counties of Oklahoma and urgent recovery centers as well. So next slide. Again, bringing together all of our partners. So the unique thing about Oklahoma is we've had our, obviously federal funding, federal partners, but then also the state, and then also tribal nations, and having the first cohort of tribal 98 grants and the second cohort. But the unique thing is that we've actually been able to work with tribal nations in Oklahoma that don't even have the 98 grant, that are just interested in making sure that there's coordination and collaboration. So, we talk about bringing everybody together, but what was the goal of bringing everybody together? The goal was having discussions and having consistent communication. So once a month, we started having a meeting where we have our call center, our ODMHSAS staff and our tribal partners coming together every month to have consistent, clear communication on what was happening, how we can better help each other, better partner. The cool aspects is that even when tribes are facing turnover, they've been able to get acclimated very quickly because they have other tribal partners they can rely on and talk to. And it's been really great asset for everybody in our cohort that we're working in. And I think it's a great model specifically for tribal nations because, we're very communal societies. We're not individualistic, and it's a great way for us to have a support system around each other as well. So next slide. Again, monthly check-ins, and Don could be a testament to the monthly check-ins and what we do, but the tribes actually formed their own work group, and they actually do their own different things. And I'm going to go ahead and hand it over to Don to talk about some of what that group does.
Thank you, Josh. Can everybody hear me? Thanks, Josh. In retrospect to what Mr. Josh was talking about, the tribal grantees and some of the other tribes that are not the grantees were able to put together this work group, tribal workforce group. And through this collaboration, we're able to move forward with building a good workforce to serve our communities. When this came about, when they was talking about equity, I had to admit, I had to look it up, and realizing, it's not the same as being equal, and that the cookie cutter process does not work for everybody, and that we're all different. And one of the things that I like about equity and the definition of equity is that we're after the same goal, but not one thing fits all. But we're after the same goal, and that is providing services for our communities. Next slide. So with that, we worked together with the state call center and tribal nations, and back in November of last year, through the work group, next slide, we came up with the idea of having a mental health summit and bringing all our tribal grantees together and having a mental health lifeline summit where we brought together the state and our tribal grantees, and with that, our SAMHSA leadership ended up being a part of that. Next slide. And with this here, it shows a little bit about that. And this was majority of our tribal grantees, our licensing board, SAMHSA, and some of the other partners that are part of our grantees, our work group. Josh was talking about the three sisters, and this is coming all together and putting this plan together to help develop policy and to help better our services across Indian country, not just serving the tribal grantees, but also serving all of Native Oklahoma, that we can get better care or more sufficient care with mental health and through 988. And that's what our hopes are. We have a great working relationship with ODMH now due to this, Solari, the call system, and a great working relationship with the 988 tribal grantees, and even some of those that are not with the 988 tribal grantees. And it seems to be working, and we all have the same common goal in place, and that is to help our Native communities where they're at, to hopefully get the same care across the board and meet their needs. And so that's where I feel, we're helping meet the needs of our Oklahoma nation and our tribes out of this work group. And this didn't come about easily. It came about through having passion and meeting, out there meeting with people. Josh, and being out there meeting with tribes and networking and having a seat at the table. So next slide, I think. And this is a picture of some of the tribal grantees and with SAMHSA leadership. You'll probably recognize a few of the people there. There's Miss Jill, Miss Monica, and Karen Hurd. I don't think Miss Delphine Rittman was there, but we have Solari there. We have some of the state officials there and some of our other tribal grantees there. So, and this didn't work without building those relationships and marrying those three sisters together. So, Josh, you have anything else?
Yeah, I was just going to jump in and add, when we're talking about this crisis continuum of care, bringing everybody together, one of the things that we're working on was pathways back into tribal behavioral health systems. So, recognizing that tribal nations are sovereign They have an ability to offer their citizens or those that live within their tribal jurisdiction behavioral health services and getting them connected to outpatient care. So we wanted to make sure that we had pathways. And one thing that we've done in this work group is work on referral pathways for those areas, those tribal nations. And we really have done some really cool things. And it really all started from us coming together, meeting, listening to each other. For me, it was really leveraging my experience growing up in my tribal community, but then being able to leverage my identity to connect with our tribal partners at the same time. And, you know, it's been amazing to see what's going on. And, you know, this picture right here with us at SAMHSA, this SAMHSA event, or not SAMHSA event, this is actually Wichita affiliated event that they hosted. Let's go ahead and go to the next slide. You don't get to have pictures like that if you don't have pictures like this. And that means getting and sitting around and getting to have dinner with each other and getting to build community. And that's bringing people together for a common goal, commonality. And next slide. I'm going to go ahead and go to our last slide, which is the next one. Again, this is my contact information and Don's as well. Our emails are right there. We're on LinkedIn. We're LinkedIn guys, so follow us. And I'm going to go ahead and hand it over to Don for any last comments.
I don't have any comments. There was a question, what are some of the ways you engage with tribes or not grantees? Meet with them. One of the things I do is I meet with them, let them know that what we're doing, and they're invited to the table. And I will help, you know, I try to do my best to help them.
Great. Thanks so much, Josh and Don, for your presentation. We appreciate it. This is an example of community engagement in action. And we appreciate all of your great insights. Again, if you have any questions, please put them in the Q&A for us to answer after all the speakers present. I also want to just thank Rochelle again for an excellent presentation and for setting the context for this discussion and providing some really great concrete how-tos and just setting the stage in terms of just defining community engagement for us and giving us just the reasons that it's so important. With that, I want to turn it over to our next presenter, Charles Rice from New York State. Charles.
Perfect. Always on mute. 3 years later after COVID, and you still start off a meeting on mute, right? But I wanted to thank everyone for this opportunity and being here, and for everyone that is here in this space, even if it is virtually. One of the things, there's one of my favorite football players. He has this quote that he uses after he doesn't speak to a lot of people. And he says, why don't you talk to people, or why don't you do interviews? And he says, because I'm about that action, boss. And as Laura just mentioned just a moment ago, community engagement is all about that action, right? It's enough about talking about what it is that we need to do within our communities, and it's time for us to actually start getting into the community and putting our feet to the ground and putting our hands to work and actually engaging them for real. So with that being said, I want to go ahead to our next slide. So here at the New York State Office of Mental Health, we are committed to creating a comprehensive crisis response system. What does that mean? It means that we want to make sure that from every level, from the lowest to the highest, that we are ensuring that people have the adequate supports and resources necessary, and they have access to those things when they need them and within their communities, whatever that may look like. And that looks like, one, starting with 988. We want 988 to be the nucleus, or that center point for everything. When you're in trouble, when someone that you care about is in trouble and they're in a mental health crisis or substance use crisis, we want to know that you can contact 988 at any time, 24 hours a day, 7 days a week, and be able to find certain resources and supports within your community. A lot of times that may look like mobile crisis, which is different for every county within New York State. Also with having access to our community residences or our CPEPs, we also have something called our crisis stabilization centers, which are getting up and running. We have about 20 of those in the works, where that's more like, if we think about it, like an urgent care for a mental health crisis, right? You can be there from an hour to up to 23 hours, and you can get the supports and resources that you're looking for in the moment. And we want that 988 to be the nucleus or the center point for all of that, and making sure that people have access to that across the state. Next slide, please. And an important thing to keep in mind when we're looking at the build of New York State, and we look at right here, you can see the landscape of New York State. You see some things about race, sex, age, and even languages spoken. And as Dr. Espiritu mentioned earlier as a co-presenter, we also have some multiple communities that we're all a part of, right? When we think about our main community, right, we can't just say we're from New York State or Oklahoma, because within those counties, there are smaller communities. And it's really important for us when we're talking about engaging communities that we keep those things in mind when we're doing so. It may look different for every community that we come in touch with, but that's okay. That just means that there's more work to be done to ensure that we're hitting all of those. Next slide, please. What does that look like? As you saw in that previous slide, those languages look different from community to community. So one of the things that we took pride in here in New York State is that we did some research and we actually came up with the top 9 languages that are spoken across New York State. So we actually have available on our website at omh.ny.gov, shameless plug there. We have available all of our resources in print form in the top 9 languages. So you can actually go online at any time, day or night, print those resources out in those top 9 languages. And the other thing we take pride in is there's actually a form on that page as well that allows you to put in a request to have other languages translated from those languages. So we have access to, and we've received requests for over 100 languages in doing so that people can have access to those materials in their native tongue. Next slide, please. And one of the things that I take pride in as a community engagement specialist is what we call coming in hot. So I actually get to go into the community. I cover all 62 counties within New York State. And one of the things I like to do is I like to come in with honesty. That actually was mentioned by Dr. Espiritu actually earlier as well. When I'm going out into communities, when we go out into communities as an agency, we like to make sure that we are coming in and we're being honest about what our expectations are of the people that we're engaging with, right? As an agency, we need to let people know what it is that we're looking to gain from our communication. The last thing that we want, I know for me personally, the last thing I want is to feel like I'm being played, right? I don't want somebody to feel like they're taking advantage of me. So I like to know what their expectation of me is when they walk into the door. So we do that by being honest about what it is that we're seeking to gain from that communication. The next thing is openness, meaning, okay, am I going to be open about what it is that we're actually working on? What is it that I need your insight or your input or your feedback in? And what is it that I'm going to use it for in the long run? And the last thing is transparency. Again, being just not being a wolf in sheep's clothing when we go out into communities, right? We don't want, a lot of times it's already hard for people, especially in certain communities, to trust, agencies, specifically government agencies, right? So we want to make sure that we're coming in, we're being transparent about the things that we're looking to do as well. The next thing is making our presence known. This is my favorite part, right? So when I say make our presence known, it means that we're meeting people where they are, right? So that may look a little bit different for, again, every community, those multiple communities that we're a part of. It may look like me going, and when I go get an edge up at the barber shop, I'm sitting and I'm having impromptu focus groups because I know there's information I need from this community, and these people are in here talking anyway. It may look like me going to a beauty salon and talking to them when I go to get a retwist for my locks and having full-blown conversations about mental health in those spaces, seeing what sort of resources and supports that they're utilizing and how their process is going with utilizing those services. Hey, have you contacted 988? What was your experience like in contacting 988? It doesn't look like me bringing them into a conference at some hotel or some convention center all the time. It may look like me going into a church on the night that they have Bible study and saying, hey, Reverend, hey, Pastor, this is what I do for a living. I was wondering if I could just have a couple of minutes of your time or your congregation's time to have a conversation with them about some resources and supports. One of the things that I've learned in this role that I have as a community engagement specialist is I often hear people say, there are no supports, there are no resources, there's nothing that we have in our community. And then I realized once I got on this side of things that there are resources and supports there. We just haven't done a great job at educating people on where they are, what they are, and how to utilize them. And that's what it looks like when we make our presence known. It may look like us stepping into a basketball tournament and just watching the game. I don't want anything from you in this moment. I just want you to see that I'm here, that I care, right? One of the things that I was a big believer in that I was told all the time growing up is that people don't care how much you know until they know how much you care. A lot of times we forget that we don't pay as much attention to communities that aren't impacting us in our daily lives. And that's a disservice to the communities that we serve. Sometimes it looks like getting our hands a little bit dirty and going down to that rec center and helping them plant flowers in their yard. And it just looks like, hey, they cared enough to come down here and be a part of the process that they say they want to change. And the last thing is being a voice of the people. One of my biggest things as a community engagement specialist is on understanding the needs of each community across New York State, ensuring not only that their voices are heard and considered, but that they're also included and the advisement of all the policies that we have and the program implementation that we have for the array of crisis services that you saw that we are implementing in New York State. Next slide, please. And the next thing we have is, so whether you're aware or not, a couple of years ago, we had an unfortunate situation here in New York State where an individual by the name of Daniel Prude, he was unalived by police in the midst of a mental health crisis. Out of that came our Daniels Law Task Force. Our Daniels Law Task Force, you can read some of the information on the screen, but in short, their job is to focus on identifying potential operational and financial needs to support trauma-informed community and public-based crisis responses and diversion to anyone experiencing a mental health crisis, whether it be alcohol or substance use as well as identifying and recommending programs or systems within that state or within or across the country that could be deployed as models for ensuring that we are taking our time to ensure that we are giving the supports and resources that are necessary in the moment for those who are contacting and needing support or assistance in that moment. Next slide, please. And here are just a couple of resources that we have available. Again, as I mentioned, our 988 webpage, which is more than a number, can also be found on omh.ny.gov, as well as our 988 partner toolkit that we got from SAMHSA as well. And again, I'll be here at the end for any questions as well. And again, I thank you for this opportunity. And I'll hand things back over to Laura.
Hi, everyone.